Adult orthodontic cases are always compromised. Would it be missing teeth or restorations or inability to achieve a positive growth? You'll never have as good results as with teenagers. Moreover, the treatment time is longer, adults complain a lot, and they won't bring their classmates into your office. So it's obvious that you have never treated an adult. However, if you still dare do it, this episode is for you. Today I'll be looking at the book Adult Orthodontics. It contains 20 chapters from a big number of contributors, predominantly from Europe. It's been edited by Birta Melson, who for many decades was the head of one of the most famous postgraduate orthodontic programs in Europe, which is in the Aarhus University in Denmark. The book was published in 2012 by Willy Blackwell. I first read it a year ago, and at that time I had an impression that it's a little bit hard to digest the material. Since the topics are quite diverse, the authors have different styles of narration, and the amount of scientific references is quite high. I returned to this book last week. I didn't read it from cover to cover this time, I just skimmed through it for a couple of hours. And to be honest, I came to a more positive conclusion this time. I'll tell you what I mean in a while, but first, let's jump into what's inside. As I told before, the chapters are diverse. There are chapters on diagnostics, etiology, temporary anchorage devices, a chapter on different bonding techniques, chapters on periodontic and prosthodontic issues in relation to orthodontic treatment, 2 chapters on temporomandibular joint disorders, a chapter on biomechanics that I still consider overcomplicated, and this is no surprise since it's been co-authored by Giorgio Fiorelli, whose cases always look like the guy wants to install his entire knowledge in mechanics into each and every patient's mouth. There is also a chapter on Invisalign with a suitable subtitle, As Many Answers as Questions. So it really has a wide range of topics, lots of illustrations, and also lots of theory, so you have to be very patient to derive practical tips out of it. However, going through this book a second time, it dawned on me that perhaps this seemingly complex structure of this book is caused by the main theme itself. Let me give you an example. When a teenager with a deep bite comes into your office, everything is relatively easy. You open the bite, whatever technique you use for it, you settle the occlusion, and it's done. When an adult deep bite comes in, it's a whole different story. There are missing teeth, there are multiple restorations, there might be a TMD already developed, supporting tissues damage, and on top of that, really high expectations. So adult orthodontic cases are complicated. And Adult Orthodontics book inherited some complexity as a result. But if you will not read it as a solid book straight away, but will think about it as of a collection of articles to refer to selectively time after time when you have issues with your adult patients, then I think you will use it the right way. Overall, I think that this book is still a great source of knowledge, and I recommend it to orthodontists who previously were more focused on treating teenagers and now are going to expand their practice towards adults. This is all for today. You can buy this book by clicking the link in the description below. Please subscribe to my channel, and I wish you good reads and stable results.